Welcome back to New to Medical Device Sales and First Year In. This is going to be a podcast where we do both because today we are bringing back our friend, our expert, Jason Elmore from Elite Execution Sales Consulting, who is going to be able to share tips from when he wished he could just tell us when he was younger and getting started. It's going to help all you first year in people, but also to everyone who's trying to interview, right? This is going to be advice that, he sees because he works with so many different people. And also most of our first year in people are at that associate sales rep role looking to make that break to the next position possibly, or how to crush it in their current role. So Jason, we've already had you on multiple times. If you guys haven't heard, we can have Jason introduce himself again, but you guys should just go back and listen because it's going to be helpful. But Jason, welcome back to the show.
Good to see you.
And good to see you.
I really enjoy the success of this effort. There's so many people trying to get in. The job market is weird. A lot of layoffs, and yet it is pretty tight.
Yes.
So there's a labor shortage, but there's still plenty of opportunities. But it's more important now than ever that you know how to make the most of your first opportunities. That you know how to interview well to get that first opportunity or get that next opportunity. So this is very timely. I'm glad you're bringing this topic up to your audience.
Yeah, no, and again, having someone like yourself who literally has been through it all in the last 20 plus years of being in medical device, med tech, that world, and now training those teams of people getting hired, you see it every single day, and you actually take those people who just got started, might not know what they're doing, to actually how to be successful sales reps and managers in the field. And there's no better person to actually talk about this with. So I'm really excited to kind of dive deep and to get your knowledge, because again, I learned from this as well. So I'm excited for this episode.
Well, your audience won't be shocked to hear today. A lot of the learnings for all of us in our careers comes from some of the mistakes we made, and I made mistakes. My break-in to med tech was with Kyphon. They had created a marketing associate role, it was a sub-rep type of thing. Kyphon was on a roll, but they needed to do more to drive market awareness and co-marketing with surgeons and this type of opportunities. But I was allocated to a particular rep in a particular territory. And I didn't navigate that conversation well. I didn't navigate that opportunity well. And it's regrettable. But I'm getting calls to that effect. People struggling with their new teams, struggling with their teammates. And there's a couple things that I would point out. One, very often, we're being given as a resource to a tenured rep, but they're a rep and they're tenured because they're not management material. That seems to be a common thread.
Yep.
And I've seen this quite a bit, right? Which says they're fantastic reps. They're number 2 in the country, and but managing other people isn't necessarily their skill set, and no fault of their own. They probably weren't given management training or any kind of training to make them make the situation go better either. So we always need to give that rep the benefit of the doubt. That's number one. Number two, sometimes the company, the architecture of this position is wrong. This rep's doing really well. We want to sprinkle them more around the territory. We want to free up some of their time. So we're going to give them an associate rep and have you cover cases. Well, that means you're going to be working with the high volume doctors. Well, the high volume doctors tend to be their most precious, most valuable, best relationships. And they're not really interested in letting us, the newbies, go in there and mess around in there. Like, you could mess stuff up. And I did. I was a little too confident, a little too arrogant, and had a couple wins early with a couple physicians and got way too comfortable way too quick. And I needed to be more respectful of the rep and more respectful of the physicians. And I just got a little too casual too quick. And they were like, who is this guy? He doesn't know Jack. He's been here like 6 months. And like, now he thinks he runs the place. I got thrown out on my ear by one of them. Just really pissed him off. But so good on most of our audience. They've got good manners. They've got self-awareness. They've got business acumen, those type of things, which is great.
Yep.
But it's kind of like being at your in-laws. You're welcome here, kind of, like you put a putt wrong and you might find yourself out of here. It's one of those situations. But um, I really needed to do a better job of understanding how the rep wins
Mhm.
and being content to help them win rather than further my own career. It's hard to be patient. It's hard for them to keep telling me that I'm new and I don't know what I don't know and I need some more experience. And we all want to be at that next position in 18 to 24 months. It's like, how can I? Oh, well, tell me what I need to learn. Tell me what I need to do. Tell me what I need to achieve. What are you looking for? Well, help me check the boxes. Help me check the boxes. You know what that sounds like to the rep? No, your job, you've been hired to help me.
Exactly.
And I'm seeing that with some of the phone calls I'm taking, people who are just impatient, want the list. Because in 24 months, they want to be sure that they did check the boxes. So I get that. But I think one of the opportunities that I missed, that I see a lot of the people I talk to that are missing, when they're navigating some of these problems, when there's issues, what I have seen is the associate rep tends to have a associate rep manager